Now, as we all know that the fourth ventricle is a cavity of the hindbrain, so हम लोग ये posterior aspect से enter कर रहे हैं. So यहाँ पे cerebellum आप देख सकते हो, we have cut a section of the cerebellum. So now, as we are entering or cutting the section of the cerebellum, you can see inside, this is the posterior surface of the pons and the open part of the medulla. Now, this whole area, the cavity that you can see over here, this rhomboid shaped structure, this is known as the fourth ventricle. We know that the fourth ventricle, the anterior relation, we have the pons over here, and on the lower part, we have the open part of the medulla. And posteriorly, we are going to have the cerebellum. Now, first, let's look into the roof of the cerebellum, fourth ventricle. Now, we know that on this lateral side, if you can see over here, we are going to have the superior cerebellar peduncles. So this is the superior cerebellar peduncle connecting the cerebellum to the midbrain. Now, in between the triangular area of both the superior cerebellar peduncles, we can see this nervous layer. This is known as the superior medullary velum. यहाँ पे we have cut this. That is why you are going to see this. नहीं तो ये पूरा tent-like structure covered है. So this is the superior medullary velum. So on the upper part, the roof of the fourth ventricle is formed by the superior medullary velum. You can very clearly see over here this sheet-like structure and nervous tissue structure, the superior medullary velum. On the inferior surface, we do not have any nervous structure forming the roof. The roof on the inferior part is going to be formed by the ependymal layer and the pia mater. See, I can pull a little sheet over here. This sheet, this is known as the inferior medullary velum. Next to the inferior medullary velum, you can also see the choroid plexus present over here. Okay, so let's look into the floor of the fourth ventricle. Now again, you can see this rhomboid shaped structure. This is the floor of the fourth ventricle. The floor of the fourth ventricle is formed by, on the upper part by the posterior surface of the pons, and on the lower part by the medulla. Now we all know that the medulla has an open surface, open part and a closed part. So the open part of the medulla is going to form the floor of the fourth ventricle. If we look properly over here, you can see a midline structure or a midline passing through over here. This is known as the median sulcus. This is the median sulcus. This median sulcus is dividing the floor of the ventricle, fourth ventricle, into two symmetrical surfaces. The median sulcus present over here. Just adjacent to the median sulcus, you can see one more sulcus. This sulcus is known as the sulcus limitans. This is the sulcus limitans. So the surface present between the median sulcus and the sulcus limitans, this area, this is known as the median eminence.
Yes.
This is the median eminence. And the surface which is present lateral to the sulcus limitans, this area, this is known as the vestibular area. So this is the median eminence and this is the vestibular area. Now, if you look properly in the median eminence, you can see a structure or an elevated area. This elevated area is known as the facial colliculus. This is the facial colliculus. Now, why is it known as facial colliculus? Okay, so on the median eminence, we have seen this elevation. This is the facial colliculus because of the presence of the abducens nerve and the turning of the fibers of the motor fibers of facial nerve. Above the sulcus limitans, if you go over here, this area, this is going to be known as the superior fovea. This area, this is the superior fovea. On the upper part of the superior fovea, if you can see, there is a bluish area present over here. This bluish area, this is known as the locus coeruleus. It's the locus coeruleus. So on the upper part, we have seen the median sulcus, the sulcus limitans, the median eminence with the facial colliculus and the vestibular area. On the upper part of the sulcus limitans, we have the superior fovea, and then on the upper part, we will be having the bluish area known as the locus coeruleus or the substantia ferruginea. On the center, you can see that some transverse fibers are running over here. These fibers are known as the stria medullaris. These are the stria medullaris. Now, beneath the stria medullaris, we can see the extension of the sulcus limitans over here. And this extension divides the whole area into two different trigones. The area between the median sulcus and this, the lower limit of the sulcus limitans, this is the hypoglossal trigone. And beneath this, this is going to be the vagal trigone. So here on the lower part, we are going to have the hypoglossal trigone and the vagal trigone. On the lower section, you can see the median sulcus on the upper part is continuous with the cerebral aqueduct. You can see over here, this is the cerebral aqueduct. And on the lower angle, this is the rostral angle and this is the caudal angle. On the caudal angle, the median sulcus continues with the central canal over here. Central canal के adjacent में जो आपको ये वाला converging area दिखाई देता है, this is known as the area postrema. This is the area postrema. And the lowest limit of the area, this is known as the obex. So here we have the obex. This tubercles that you can see, this tubercle is the gacile tubercle, this is the cuneate tubercles. So the lower limit of the fourth ventricle, this is known as the obex. Now if you look properly, the lower section, the lower part, इस एरिया में अगर आप देखेंगे तो एक पेन के निप की तरह आपको दिखाई दे रहा है, this one. It looks like the nip of a pen. So this area is also known as the calamus scriptorius.
Yes.
Now, if we look at the floor, I mean the roof, आप देख सकते हो यहाँ पे, this is going to be the lateral recess. आप लोगों ने 5 recess पढ़े थे. Here we have the lateral recess. This lateral recess has the foramen which is known as the foramen of Luschka. Both the foramens are present over here. So here, this lateral recess, we will be having the foramen Luschka. At this point, we are going to have the foramen Magendie. On this area, we are this lateral recess, जो foramen Luschka है, this is going to go anteriorly and will communicate over here. If you can see, there are openings present over here. See, this is the opening present over here.
देखते ना चीज, आज clear cut. Absolutely clear. Yes.
Okay. So on the lateral side, you can see this is the flocculus of the cerebellum. And on the medial side, you can see this is the inferior cerebellar peduncle. In between these two structures, we have the opening, जो कि lateral recess से यहाँ तक आया है, and will communicate with the cistern, which is present over here, known as the cisterna pontine.